1. What is the most common risk factor for developing lung cancer? A. Family history. B. Smoking. C. Age over 50. D. Exposure to sunlight. Answer: B. Smoking. Rationale: smoking is the most significant risk factor for lung cancer. It accounts for 85% of all lung cancer cases. Family history, age, and exposure to sunlight may increase the risk, but are not as strongly correlated with lung cancer as smoking. 2. Which of the following is the most common form of breast cancer? A. Inflammatory breast cancer. B. Ductal carcinoma in situ (CIS). C. Invasive ductal carcinoma, IDC. D. Lobular carcinoma. Answer: C. Invasive ductal carcinoma, IDC. Rationale: IDC is the most common type of breast cancer, accounting for about 70 to 80% of all cases. CIS is a non-invasive form, and inflammatory breast cancer is rare. Lobular carcinoma is less common than IDC. 3. Which of the following is a common side effect of chemotherapy? A. Diarrhea. B. Hair loss. C. Hypertension. D. Weight gain. Answer: B. Hair loss. Rationale: hair loss is a well-known side effect of chemotherapy due to its impact on rapidly dividing cells, including those in hair follicles. Diarrhea, hypertension, and weight gain may occur in specific cases, but are not as commonly associated with chemotherapy. 4. What is the most effective screening method for cervical cancer? A. Mammography. B. Pap smear. C. Colonoscopy. D. Chest X-ray. Answer: B. Pap smear. Rationale: the Pap smear is the most effective screening tool for cervical cancer, as it detects abnormal cells that could develop into cancer. Mammography screens for breast cancer, colonoscopy for colon cancer, and chest X-rays are used for lung cancer. 5. Which of the following is a characteristic of metastasis? A. Cancer cells spread locally without leaving the tissue of origin. B. Cancer cells spread through the bloodstream or lymphatic system. C. Metastasis occurs only in solid tumors. D. Metastatic tumors are always benign. Answer: B. Is cancer cells spread through the bloodstream or lymphatic system. Rationale: metastasis refers to the spread of cancer cells to distant parts of the body through the bloodstream or lymphatic system. It can occur in both solid tumors and hematologic cancers, and metastatic tumors are malignant, not benign. 6. Which of the following is a hallmark sign of colon cancer? A. Hematuria. B. Change in bowel habits. C. Unexplained weight gain. D. Shortness of breath. Answer: B. Change in bowel habits. Rationale: a common sign of colon cancer is a change in bowel habits, such as persistent diarrhea or constipation. Hematuria is associated with urinary tract issues. Weight gain and shortness of breath are nonspecific symptoms. 7. What is the main goal of palliative care for a cancer patient? A. To cure the cancer. B. To reduce pain and improve quality of life. C. To provide experimental treatments. D. To increase survival rates. Answer: B. To reduce pain and improve quality of life. Rationale: palliative care focuses on alleviating symptoms, reducing pain, and improving the quality of life for cancer patients, especially those with advanced disease. It is not aimed at curing the cancer or increasing survival rates. 8. Which type of cancer is most commonly associated with the Epstein-Barr virus, EBV? A. Leukemia. B. Hodgkin lymphoma. C. Prostate cancer. D. Skin cancer. Answer: B. Hodgkin lymphoma. Rationale: Hodgkin lymphoma is most commonly associated with Epstein-Barr virus, EBV, infection. While EBV is also linked to other cancers like nasopharyngeal carcinoma, it is most strongly associated with Hodgkin lymphoma. 9. What is the primary treatment for non-small cell lung cancer, NSCLC? A. Radiation therapy only. B. Chemotherapy alone. C. Surgical resection. D. Targeted therapy. Answer: C. Surgical resection. Rationale: surgical resection is the primary treatment for early-stage non-small cell lung cancer, NSCLC. Chemotherapy, radiation, and targeted therapies may be used as adjuncts, especially in later stages or for patients who are not candidates for surgery. 10. What is the most common cause of death in patients with breast cancer? A. Cardiac complications. B. Metastasis. C. Respiratory failure. D. Infection. Answer: B. Metastasis. Rationale: the most common cause of death in breast cancer patients is metastasis, typically to the lungs, liver, or bones. Cardiac complications, respiratory failure, and infections may contribute to death, but are not the primary causes in breast cancer patients. 11. Which of the following is a common late effect of radiation therapy? A. Diarrhea. B. Fatigue. C. Osteoporosis. D. Skin irritation. Answer: C. Osteoporosis. Rationale: osteoporosis is a common late effect of radiation therapy, especially when radiation is directed at bone-rich areas. Fatigue, diarrhea, and skin irritation can occur during treatment, but are typically not late effects. 12. Which of the following cancers is most commonly diagnosed in children? A. Brain tumors. B. Leukemia. C. Lymphoma. D. Osteosarcoma. Answer: B. Leukemia. Rationale: leukemia is the most common cancer diagnosed in children, particularly acute lymphoblastic leukemia, ALL. Brain tumors, lymphoma, and osteosarcoma are also common but less frequent in pediatric populations. 13. What is the most common site for metastasis in prostate cancer? A. Liver. B. Lungs.
C. Bone. D. Brain.
Answer: C's bone. Rationale: bone is the most common site for metastasis in prostate cancer, particularly in the pelvis, spine, and hips. While prostate cancer can spread to the liver, lungs, and brain, bone is the predominant site. 14. Which of the following is a known risk factor for developing cervical cancer? A. Human papillomavirus, HPV, infection. B. Obesity. C. Family history of colorectal cancer. D. High-fiber diet. Answer: A. Human papillomavirus, HPV, infection. Rationale: HPV infection, particularly types 16 and 18, is the most significant risk factor for developing cervical cancer. While obesity and family history may increase the risk for other cancers, they are not significant risk factors for cervical cancer. 15. Which lab value is most commonly elevated in patients with liver metastasis from cancer? A. BUN. B. AST and ALT. C. Creatinine. D. Bilirubin. Answer: B. AST and ALT. Rationale: AST and ALT are liver enzymes that are typically elevated in patients with liver metastasis. BUN and creatinine are markers for kidney function, and bilirubin is elevated in conditions like jaundice, but is not the primary indicator of liver metastasis. 16. Which of the following is the most common symptom of pancreatic cancer? A. Jaundice. B. Severe abdominal pain. C. Nausea and vomiting. D. Unexplained weight loss. Answer: D. Unexplained weight loss. Rationale: unexplained weight loss is one of the most common symptoms of pancreatic cancer, as the cancer often affects digestion and metabolism. Jaundice, abdominal pain, nausea, and vomiting may also occur but are not as frequent in early stages. 17. Which of the following is a side effect of radiation therapy for brain cancer? A. Vision loss. B. Hearing loss. C. Cognitive impairment. D. Hearing loss. Answer: C. Cognitive impairment. Rationale: cognitive impairment is a common side effect of radiation therapy for brain cancer, especially when radiation is directed at the frontal lobes. Vision loss and hearing loss may occur with specific radiation sites, but cognitive issues are more commonly observed. 18. Which cancer is most strongly associated with smoking? A. Esophageal cancer. B. Lung cancer. C. Skin cancer. D. Bladder cancer. Answer: B. Lung cancer. Rationale: smoking is the most significant risk factor for lung cancer. It also increases the risk of bladder, esophageal, and other cancers, but lung cancer has the strongest association with smoking. 19. What is the most appropriate treatment for localized Hodgkin lymphoma? A. Chemotherapy alone. B. Radiation therapy alone. C. Chemotherapy and radiation therapy. D. Bone marrow transplant. Answer: C. Chemotherapy and radiation therapy. Rationale: localized Hodgkin lymphoma is typically treated with a combination of chemotherapy and radiation therapy. Bone marrow transplant is considered for advanced or refractory cases. 20. Which of the following is a common complication of chemotherapy? A. Electrolyte imbalances. B. Hyperglycemia. C. Muscle weakness. D. Alopecia. Answer: D. Alopecia. Rationale: alopecia, hair loss, is a common and well-known side effect of chemotherapy. Electrolyte imbalances, hyperglycemia, and muscle weakness may occur, but they are not as universally associated with chemotherapy as alopecia. 21. Which of the following is a common presenting symptom of leukemia in children? A. Fever and fatigue. B. Weight loss. C. Jaundice. D. Shortness of breath. Answer: A. Fever and fatigue. Rationale: fever and fatigue are common presenting symptoms of leukemia in children, often due to the body's inability to fight infections and the suppression of normal blood cells. Jaundice, weight loss, and shortness of breath can also occur but are less common as initial symptoms. 22. Which of the following cancers is most often diagnosed through a colonoscopy? A. Colorectal cancer. B. Lung cancer. C. Kidney cancer. D. Bladder cancer. Answer: A. Colorectal cancer. Rationale: colorectal cancer is most commonly diagnosed through colonoscopy, which allows for direct visualization of the colon and detection of abnormal growths. Lung, kidney, and bladder cancers are diagnosed with different imaging and diagnostic techniques. 23. What is the most common side effect of immunotherapy in cancer treatment? A. Nausea and vomiting. B. Diarrhea. C. Fatigue. D. Hair loss. Answer: C. Fatigue. Rationale: fatigue is a common side effect of immunotherapy as it affects the immune system and can cause systemic inflammation. Nausea, diarrhea, and hair loss may also occur but are less common. 24. What is the primary treatment for melanoma? A. Chemotherapy. B. Immunotherapy. C. Surgery. D. Radiation therapy. Answer: C. Surgery. Rationale: surgery is the primary treatment for melanoma, especially if the tumor is detected early and has not spread. Chemotherapy, immunotherapy, and radiation therapy may be used in advanced cases. 25. Which of the following cancers has a strong link to a family history of cancer? A. Prostate cancer. B. Leukemia. C. Breast cancer. D. Colorectal cancer. Answer: C. Breast cancer. Rationale: a family history of breast cancer is a known risk factor, particularly for women with a genetic predisposition, BRCA1 or BRCA2 mutations. Prostate, leukemia, and colorectal cancers may also have genetic components, but are less strongly associated with family history. 26. Which of the following is a risk factor for developing ovarian cancer? A. Early menopause. B. Use of birth control pills. C. Family history of breast cancer. D. Having multiple children. Answer: C. Family history of breast cancer. Rationale: a family history of breast cancer, particularly in first-degree relatives, increases the risk of ovarian cancer. Early menopause, birth control pills, and having multiple children can reduce the risk of ovarian cancer. 27. Which of the following is a common side effect of hormone therapy for breast cancer? A. Weight loss. B. Hot flashes. C. Diarrhea. D. Increased appetite. Answer: B. Hot flashes. Rationale: hot flashes are a common side effect of hormone therapy for breast cancer as it lowers estrogen levels. Weight loss, diarrhea, and increased appetite are not typical side effects of hormone therapy. 28. Which of the following cancers is often diagnosed through a skin biopsy? A. Lung cancer. B. Melanoma. C. Breast cancer. D. Colorectal cancer. Answer: B. Melanoma. Rationale: melanoma is commonly diagnosed through a skin biopsy as it originates in the skin. Lung, breast, and colorectal cancers require different diagnostic methods. 29. Which of the following is a common side effect of targeted cancer therapy? A. Hair loss. B. Nausea and vomiting. C. Skin rash. D. Diarrhea. Answer: C. Skin rash. Rationale: skin rash is a common side effect of targeted cancer therapies, particularly with drugs targeting the epidermal growth factor receptor, EGFR. Hair loss, nausea, and diarrhea may occur with other treatments like chemotherapy. 30. What is the most common type of skin cancer? A. Melanoma. B. Basal cell carcinoma. C. Squamous cell carcinoma. D. Kaposi sarcoma. Answer: B. Basal cell carcinoma. Rationale: basal cell carcinoma is the most common type of skin cancer. It is typically slow-growing and rarely metastasizes. Melanoma is more aggressive but less common. Squamous cell carcinoma and Kaposi sarcoma are also types of skin cancer, but are less common. 31. Which of the following cancers is most often diagnosed in the elderly population? A. Testicular cancer. B. Ovarian cancer. C. Prostate cancer. D. Cervical cancer. Answer: C. Prostate cancer. Rationale: prostate cancer is the most common cancer diagnosed in elderly men. Testicular cancer is more common in younger men, while ovarian cancer and cervical cancer are more common in women, with different age distributions. 32. Which of the following is the first-line treatment for small cell lung cancer, SCLC? A. Surgery. B. Chemotherapy. C. Immunotherapy. D. Radiation therapy. Answer: B. Chemotherapy. Rationale: chemotherapy is the first-line treatment for small cell lung cancer, SCLC, as it is often diagnosed at an advanced stage and is highly responsive to chemotherapy. Surgery is rarely an option, and radiation and immunotherapy may be used adjunctively. 33. Which of the following is a common side effect of radiation therapy to the head and neck? A. Alopecia. B. Dry mouth, xerostomia. C. Nausea. D. Weight gain. Answer: B. Dry mouth, xerostomia. Rationale: radiation therapy to the head and neck often results in dry mouth, xerostomia, due to damage to the salivary glands. Alopecia, nausea, and weight gain can occur with other types of therapy, but are less specific to head and neck radiation. 34. What is the primary function of the tumor marker CA-125? A. To diagnose liver cancer. B. To assess the response to cancer treatment. C. To detect pancreatic cancer. D. To monitor ovarian cancer. Answer: D. To monitor ovarian cancer. Rationale: CA-125 is primarily used to monitor the treatment response and detect recurrence of ovarian cancer. While it may be elevated in other cancers, its main application is in ovarian cancer. 35. Which of the following is a known risk factor for endometrial cancer? A. Use of oral contraceptives. B. Obesity. C. Early menopause. D. Smoking. Answer: B. Obesity. Rationale: obesity is a known risk factor for endometrial cancer due to increased estrogen production from fat tissue. Use of oral contraceptives and early menopause are protective factors, and smoking is not directly linked to endometrial cancer. 36. Which of the following is a common early symptom of ovarian cancer? A. Pelvic pain. B. Unexplained weight loss. C. Painful urination. D. Fatigue. Answer: A. Pelvic pain. Rationale: pelvic pain is a common early symptom of ovarian cancer, often accompanied by bloating or changes in bowel habits. Unexplained weight loss, painful urination, and fatigue may occur but are not as common in early stages. 37. Which of the following cancers is most associated with a family history of colon cancer? A. Prostate cancer. B. Colorectal cancer. C. Melanoma. D. Leukemia. Answer: B. Colorectal cancer. Rationale: a family history of colorectal cancer is the strongest risk factor for developing colorectal cancer. While family history can influence the risk of prostate cancer, melanoma, and leukemia, the link to colorectal cancer is most prominent. 38. Which of the following is a potential side effect of chemotherapy that affects the blood? A. Hyperglycemia. B. Neutropenia. C. Hypertension. D. Hypokalemia. Answer: B. Neutropenia. Rationale: neutropenia, a decrease in neutrophils, a type of white blood cell, is a common side effect of chemotherapy, increasing the risk of infection. Hyperglycemia, hypertension, and hypokalemia are less commonly associated with chemotherapy. 39. What is the recommended treatment for early-stage Hodgkin lymphoma? A. High-dose chemotherapy. B. Bone marrow transplant. C. Radiation therapy. D. Chemotherapy and radiation therapy. Answer: D. Chemotherapy and radiation therapy. Rationale: early-stage Hodgkin lymphoma is typically treated with a combination of chemotherapy and radiation therapy, which is effective in achieving remission. High-dose chemotherapy and bone marrow transplant are used for advanced or refractory cases. 40. Which of the following cancers is most commonly associated with a human papillomavirus, HPV? A. Ovarian cancer. B. Esophageal cancer. C. Cervical cancer. D. Lung cancer. Answer: C. Cervical cancer. Rationale: cervical cancer is most commonly associated with HPV infection, especially types 16 and 18. While HPV may play a role in other cancers such as anal and oropharyngeal cancer, it is most strongly linked to cervical cancer. 41. Which of the following is a common treatment for metastatic breast cancer? A. Surgery. B. Radiation therapy. C. Hormone therapy. D. Watchful waiting. Answer: C. Hormone therapy. Rationale: hormone therapy is commonly used to treat metastatic breast cancer, especially when the cancer is hormone receptor positive. Surgery and radiation therapy are less commonly used for metastatic disease, and watchful waiting is not a recommended treatment approach. 42. Which of the following is the most common risk factor for developing lung cancer? A. Obesity. B. Age. C. Smoking. D. Family history. Answer: C. Smoking. Rationale: smoking is the leading risk factor for developing lung cancer. While age, family history, and obesity may contribute to cancer risk, smoking is by far the most significant risk factor for lung cancer. 43. What is the most common method used to diagnose breast cancer? A. Mammography. B. Ultrasound. C. Biopsy. D. MRI. Answer: A. Mammography. Rationale: mammography is the most commonly used method for screening and diagnosing breast cancer. Ultrasound and MRI are used for further evaluation, and biopsy is required for definitive diagnosis. 44. Which of the following is a potential side effect of radiation therapy to the pelvic region? A. Diarrhea. B. Alopecia. C. Weight loss. D. Nausea. Answer: A. Diarrhea. Rationale: diarrhea is a common side effect of pelvic radiation therapy, as it can affect the intestines. Alopecia, weight loss, and nausea are more commonly associated with other treatments, such as chemotherapy. 45. Which of the following cancers is most likely to be diagnosed with a Pap smear? A. Endometrial cancer. B. Cervical cancer. C. Ovarian cancer. D. Vaginal cancer. Answer: B. Cervical cancer. Rationale: a Pap smear is a screening tool for cervical cancer. While it can detect abnormal cells that may lead to cancer, it is not used to diagnose endometrial, ovarian, or vaginal cancers. 46. What is the most common symptom of brain metastasis? A. Seizures. B. Nausea and vomiting. C. Unexplained weight loss. D. Hemiparesis. Answer: A. Seizures. Rationale: seizures are a common symptom of brain metastasis, particularly when the tumor affects the cerebral cortex. Nausea, vomiting, unexplained weight loss, and hemiparesis may occur but are less common. 47. Which of the following is a common complication of cancer-related hypercalcemia? A. Hypotension. B. Dehydration. C. Muscle weakness. D. Anemia. Answer: C. Muscle weakness. Rationale: muscle weakness is a common complication of hypercalcemia, a condition that can occur in cancer due to excessive calcium release from bones. Hypotension and dehydration may also be present, but muscle weakness is a hallmark of hypercalcemia. 48. What is the most common site of metastasis for melanoma? A. Lungs.
B. Bone.
C. Liver.
D. Brain.
Answer: A. Lungs. Rationale: the lungs are the most common site of metastasis for melanoma. While melanoma can spread to the bones, liver, and brain, the lungs are typically affected first. 49. Which of the following is a common side effect of targeted therapy for cancer? A. Skin rash. B. Weight loss.
C. Nausea.
D. Diarrhea. Answer: A. Skin rash. Rationale: skin rash is a common side effect of targeted therapies, particularly those that inhibit epidermal growth factor receptors, EGFR. While nausea, diarrhea, and weight loss can occur with other treatments like chemotherapy, they are less common with targeted therapy. 50. Which of the following is the most common cancer in men? A. Prostate cancer. B. Lung cancer. C. Testicular cancer. D. Colon cancer. Answer: A. Prostate cancer. Rationale: prostate cancer is the most common cancer in men, especially in older men. Lung, testicular, and colon cancers also affect men, but prostate cancer has the highest incidence. 51. Which of the following is the most common symptom of acute leukemia? A. Fever. B. Hemoptysis. C. Abdominal pain. D. Headache. Answer: A. Fever. Rationale: fever is a common symptom of acute leukemia due to infection and bone marrow dysfunction. Hemoptysis, abdominal pain, and headache can occur in other conditions, but are not as common in acute leukemia. 52. Which of the following is an early sign of colorectal cancer? A. Unexplained weight gain. B. Hematochezia. C. Shortness of breath. D. Jaundice. Answer: B. Hematochezia. Rationale: hematochezia, bright red blood in the stool, is an early sign of colorectal cancer, which may also present with changes in bowel habits. Weight gain, shortness of breath, and jaundice are more commonly associated with other conditions. 53. Which of the following cancers is associated with the Epstein-Barr virus, EBV? A. Stomach cancer. B. Breast cancer. C. Nasopharyngeal cancer. D. Thyroid cancer. Answer: C. Nasopharyngeal cancer. Rationale: nasopharyngeal cancer is strongly associated with Epstein-Barr virus, EBV, infection. While EBV may also play a role in other cancers like stomach cancer, it is most strongly linked to nasopharyngeal cancer. 54. Which of the following is a major risk factor for developing pancreatic cancer? A. High-fat diet. B. Smoking. C. Excessive alcohol consumption. D. Age over 50. Answer: B. Smoking. Rationale: smoking is a significant risk factor for pancreatic cancer. While a high-fat diet, alcohol consumption, and age over 50 may increase cancer risk, smoking is the strongest risk factor for pancreatic cancer. 55. Which of the following tests is most commonly used to diagnose lung cancer? A. Chest X-ray. B. MRI. C. Bronchoscopy. D. PET scan. Answer: A. Chest X-ray. Rationale: chest X-ray is often the first test used to detect lung cancer. Further diagnostic procedures, like bronchoscopy, MRI, and PET scans, may be performed for staging and biopsy. 56. Which of the following is a common side effect of chemotherapy? A. Alopecia. B. Hypertension. C. Hyperglycemia. D. Jaundice. Answer: A. Alopecia. Rationale: alopecia, hair loss, is a common side effect of chemotherapy due to its effect on rapidly dividing cells. Hypertension, hyperglycemia, and jaundice are less commonly associated with chemotherapy. 57. Which of the following cancers is most commonly diagnosed through a biopsy? A. Colon cancer. B. Skin cancer. C. Lung cancer. D. Stomach cancer. Answer: C. Lung cancer. Rationale: a biopsy is required to definitively diagnose lung cancer, often performed through a bronchoscopy or needle biopsy. Colon, skin, and stomach cancers are often diagnosed with imaging studies or other non-invasive methods. 58. Which of the following cancers is most likely to present with unexplained weight loss as an early symptom? A. pancreatic cancer. B. Leukemia. C. Breast cancer. D. Cervical cancer. Answer: A. Pancreatic cancer. Rationale: unexplained weight loss is an early and common symptom of pancreatic cancer due to the tumor's effect on digestion and metabolism. Leukemia, breast cancer, and cervical cancer may also cause weight loss, but it is not typically an early symptom. 59. What is the most important preventive measure for cervical cancer? A. HPV vaccination. B. Regular mammograms. C. Smoking cessation. D. Colonoscopy. Answer: A. HPV vaccination. Rationale: the most important preventive measure for cervical cancer is the HPV vaccination, which protects against the virus most commonly associated with the development of cervical cancer. Mammograms, smoking cessation, and colonoscopy are important for other cancers. 60. Which of the following cancers is most likely to metastasize to the bone? A. Lung cancer. B. Colorectal cancer. C. Prostate cancer. D. Ovarian cancer. Answer: C. Prostate cancer. Rationale: prostate cancer commonly metastasizes to the bone, particularly to the spine and pelvis. Lung and colorectal cancers can also metastasize to the bone, but prostate cancer has the highest tendency for bone metastasis. 61. Which of the following is a characteristic feature of basal cell carcinoma? A. Raised, pearly lesions with a rolled border. B. Irregular, multicolored nodules. C. Scaly, red patches. D. Deep, ulcerated lesions. Answer: A. Raised, pearly lesions with a rolled border. Rationale: basal cell carcinoma typically presents as raised, pearly lesions with a rolled border. Squamous cell carcinoma may appear as scaly, red patches, while melanoma may present as irregular, multicolored nodules. 62. Which of the following is a common sign of esophageal cancer? A. Hematemesis. B. Difficulty swallowing. C. Nausea and vomiting. D. Jaundice. Answer: B. Difficulty swallowing. Rationale: difficulty swallowing, dysphagia, is a common sign of esophageal cancer, often due to the tumor obstructing the esophagus. Hematemesis, nausea, vomiting, and jaundice are more commonly associated with other gastrointestinal conditions. 63. Which of the following is the most common treatment modality for non-small cell lung cancer, NSCLC? A. Surgery. B. Radiation therapy. C. Chemotherapy. D. Targeted therapy. Answer: A. Surgery. Rationale: surgery is the most common treatment for early-stage non-small cell lung cancer, NSCLC, especially when the tumor is localized. Chemotherapy, radiation, and targeted therapy may be used for advanced stages or in combination with surgery. 64. Which of the following is a typical sign of liver cancer? A. Jaundice. B. Hemoptysis. C. Bone pain. D. Weight loss. Answer: A. Jaundice. Rationale: jaundice, yellowing of the skin and eyes, is a typical sign of liver cancer due to impaired liver function. Bone pain, hemoptysis, and weight loss can occur with other cancers, but are less specific to liver cancer. 65. Which of the following is a major complication of untreated oral cancer? A. Tooth decay. B. Metastasis to the lungs. C. Respiratory distress. D. Chronic headaches. Answer: C. Respiratory distress. Rationale: untreated oral cancer can lead to airway obstruction and respiratory distress, particularly if the tumor grows large enough to block the airway. Metastasis to the lungs, tooth decay, and chronic headaches are less immediate complications. 66. Which of the following cancers is most commonly associated with smoking? A. Breast cancer. B. Kidney cancer. C. Lung cancer. D. Bladder cancer. Answer: C. Lung cancer. Rationale: smoking is the most significant risk factor for lung cancer, with a strong correlation between smoking and the development of lung cancer. While smoking is also associated with bladder and kidney cancer, lung cancer is the most strongly linked. 67. Which of the following laboratory findings is most indicative of liver metastasis from a solid tumor? A. Elevated liver enzymes. B. Low white blood cell count. C. High hemoglobin levels. D. Elevated creatinine levels. Answer: A. Elevated liver enzymes. Rationale: elevated liver enzymes, AST, ALT, alkaline phosphatase, are indicative of liver involvement in metastasis. Low white blood cell count, high hemoglobin levels, and elevated creatinine are not specifically linked to liver metastasis. 68. Which of the following is the first-line treatment for Hodgkin lymphoma? A. Chemotherapy. B. Radiation therapy. C. Bone marrow transplant. D. Surgery. Answer: A. Chemotherapy. Rationale: chemotherapy is the first-line treatment for Hodgkin lymphoma, often used in combination with radiation therapy. Surgery and bone marrow transplant are typically reserved for more advanced or resistant cases. 69. Which of the following is the most common cause of cervical cancer? A. HPV infection. B. Herpes simplex virus. C. Smoking. D. Chronic chlamydia infection. Answer: A. HPV infection. Rationale: HPV infection, particularly types 16 and 18, is the most common cause of cervical cancer. Smoking, herpes simplex, and chronic chlamydia infections may increase the risk, but are not the primary cause. 70. What is the most common clinical feature of leukemia in children? A. Fever. B. Anemia. C. Night sweats. D. Bone pain. Answer: D. Bone pain. Rationale: bone pain is one of the most common symptoms of leukemia in children, as leukemia affects the bone marrow. Fever, anemia, and night sweats may also occur but are not as characteristic as bone pain. 71. Which of the following is a common side effect of radiation therapy? A. Weight gain. B. Fatigue. C. Hypertension. D. Hyperglycemia. Answer: B. Fatigue. Rationale: fatigue is a common and often persistent side effect of radiation therapy due to the body's response to cellular damage. Weight gain, hypertension, and hyperglycemia are less directly related to radiation therapy. 72. Which of the following cancers is most likely to cause hypercalcemia? A. Non-small cell lung cancer. B. Renal cell carcinoma. C. Squamous cell carcinoma of the head and neck. D. Multiple myeloma. Answer: D. Multiple myeloma. Rationale: multiple myeloma often causes hypercalcemia due to the breakdown of bone tissue. Other cancers can cause hypercalcemia, but to a lesser degree. 73. What is the primary treatment for localized prostate cancer? A. Radiation therapy. B. Chemotherapy. C. Radical prostatectomy. D. Hormonal therapy. Answer: C. Radical prostatectomy. Rationale: radical prostatectomy is the primary treatment for localized prostate cancer. Radiation therapy and chemotherapy may be used in advanced stages, and hormonal therapy may be used to manage advanced or recurrent disease. 74. Which of the following is the most common site of metastasis for breast cancer? A. Brain. B. Bone. C. Liver. D. Lungs. Answer: B. Bone. Rationale: the bone is the most common site of metastasis for breast cancer, particularly the spine, ribs, and pelvis. Other sites such as the liver, lungs, and brain can also be affected but are less common. 75. Which of the following is a major risk factor for developing skin cancer? A. Fair skin. B. High-fat diet. C. Family history of breast cancer. D. High alcohol consumption. Answer: A. Fair skin. Rationale: fair skin, which is more sensitive to UV radiation, is a major risk factor for developing skin cancer. High-fat diet, family history of breast cancer, and alcohol consumption are not as strongly linked to skin cancer. 76. Which of the following statements about chemotherapy-induced nausea and vomiting, CNV, is true? A. CNV can be prevented with antiemetic drugs. B. CNV is rarely seen with chemotherapy. C. CNV always occurs within the first 24 hours. D. CNV is only a concern during the first cycle of chemotherapy. Answer: A. CNV can be prevented with antiemetic drugs. Rationale: chemotherapy-induced nausea and vomiting, CNV, can often be prevented or minimized with antiemetic medications. CNV is common, can occur at any time during treatment, and can occur during multiple cycles. 77. Which of the following cancers is most likely to be diagnosed with a pap smear? A. Ovarian cancer. B. Endometrial cancer. C. Cervical cancer. D. Vaginal cancer. Answer: C. Cervical cancer. Rationale: a pap smear is the primary screening test for cervical cancer, detecting abnormal cells in the cervix that may lead to cancer. Ovarian, endometrial, and vaginal cancers are not diagnosed with a pap smear. 78. Which of the following is the first step in staging breast cancer? A. Biopsy. B. MRI. C. Chest X-ray. D. Sentinel lymph node biopsy. Answer: A. Biopsy. Rationale: a biopsy is the first step in staging breast cancer to confirm the diagnosis. Other diagnostic tests like MRI, chest X-ray, and sentinel lymph node biopsy are used for further staging and assessment. 79. Which of the following is a common complication of breast cancer surgery? A. Lymphedema. B. Infection. C. Anemia. D. Hypertension. Answer: A. Lymphedema. Rationale: lymphedema is a common complication of breast cancer surgery, especially when lymph nodes are removed. Infection, anemia, and hypertension are possible, but less directly related to surgery. 80. Which of the following cancers is most likely to cause pain due to bone metastasis? A. Ovarian cancer. B. Non-small cell lung cancer. C. Renal cancer. D. Prostate cancer. Answer: D. Prostate cancer. Rationale: prostate cancer is known to metastasize to the bones, causing pain, particularly in the spine, hips, and pelvis. Bone metastasis is less common in ovarian, lung, and renal cancers.